It being the appointed hour, we will call the committee to order. And first up is the Office of Professional Licensure and Certification. Somehow we usually see you guys at rules.
Yes. Good afternoon. Lindsay Courtney, Executive Director, OPLC. With me is Heather Kelly, our Director of Operations. And thank you, Mr. Chair, members of the committee, for taking the time today to speak with us. I have before you our PowerPoint presentation, and I just figured I'd start off by giving you a brief overview of who we are and what we do and what we don't do. Most of you, I think, are familiar with the office, but essentially we're the body that provides administrative support to the large majority of the state's licensing boards. We presently have a little over 50 boards. We are proposed to get a few more, and what the current version of HB2 is. 7 of our boards are advisory boards, meaning they don't have independent regulatory authority. And there were some proposals initially in HB2 to convert other boards to advisory boards. That is no longer in that current bill. But essentially what we do is we perform 2 major functions. We provide assistance with licensing as well as the board's administrative functions, and then we provide assistance with enforcement. And the reason why I think that's important to note is that's a change from the last biennium when the Administrative Prosecutions Unit was eliminated at the Department of Justice, and we took on that role in-house. And so you'll see the change from FY22 in terms of transfers to other state agencies has decreased because we are now performing those functions in-house. And then finally, I would just note that we are fully self-funded agency. Our fees have to bear a relationship to licensing and the issue of a license and inspection and regulating the business. Historically, in the last couple of years, our funds have lapsed at the end of every fiscal year, and then last biennium was modified to lapse at the end of every biennium. There are some proposals, both in HB2, HB 655, Senate Bill 49, that would eliminate our lapsing fund and just create a dedicated fund. And there are differences between those bills, but essentially that's what's presently out there that could impact the budget. So on the second page is just our agency structure, and I'm a visual person and thought that might be helpful for you, but I won't go into it in greater detail. What I wanted to do, though, on page 4 is talk about our guiding principles. This has really informed how we tried to put together a budget that made sense in order to meet the agency's initiatives. And I want to take a moment to clarify what we think the role of the boards are versus the role of the office. The role of the boards is always to promote public protection. Our role is a little bit different in the sense that we provide administrative support, and we're required by statute to do it in the most efficient and economic manner. And so this past year and a half, we've done some strategic planning really to try to figure out where we'd like to see ourselves in 10 years. And you'll note our vision really is to just transform and modernize the support for New Hampshire's professional licensing boards to achieve regulatory excellence. And that's where we see ourselves going. That's where I think this budget will help us get. But of potential interest is our FY23 to FY25 strategic goals. We have 4 major goals which are noted below. One seems obvious, which is to fulfill all statutory and regulatory requirements, which seems a given, but I think many of you know that has not always been the case with many of our boards. If you look at a lot of the audits, LBA audits dating back to, 2012, 2009. I mean, there are some consistent issues that we've seen amongst our licensing boards and that we're trying to remediate. The second is enhancing customer service. The third is increasing licensure portability, and certainly that's necessary from a workforce standpoint. And then finally, obviously, to promote public protection, which is the key role of these boards. So turning to the next page, there are 3 ways that we're trying to accomplish some of these strategic goals. And the first is a major undertaking to migrate our current licensing portal over to a new licensing system. So we propose to achieve efficient operations by leveraging technology in this way. Our current licensing portal is an enterprise solution that dates back 2012, I believe. It predates the office, and it was bare bones. It does what it needs to do, but it doesn't do anything other than capture certain data and allow us to issue a license in an electronic format. It's not meeting our needs, and I think that's been observed by the LBA in the most recent audit and the dental examiners. So we worked with DOIT to procure some ARPA funding. That contract was approved recently, and we started phase 1 of our migration to a new system just a couple of weeks ago. So we're really excited about that. But that, I think, is going to help transform and modernize our licensing system. Second, we're working on implementing new technology through a no-cost contract to move all of our continuing education tracking online as opposed to a manual process. And I can tell you the manual process is very time-consuming and requires a lot of personnel. I spent the better part of last week doing real estate audits, so I have a lot of experience with that, and it's just not the best use of our resources. So we propose to move all of our continuing education audits and tracking online. And that project began in February of 2023. And then finally, in order to make all of this happen, we need to establish internal controls throughout the agency. And what this means is we have assigned 6 attorneys, including myself, to conduct a statutory review of all of our licensing boards and their practice acts, all of their rules, making sure that the rules do not contradict or contravene statutory requirements, that we have rules in place for all of the statutory mandates, that we have policies and procedures implementing those rules, and that what we are requiring of licensees is actually what's required in the law. And we have not touched any board that has not had any issues with respect to statutory regulatory compliance. So this is a huge undertaking. It's a very aggressive timeline. And we expect to be completed phase 1 of our migration and our internal controls project at this time next year. So I provide you that background to really talk about the proposed increases in the House, what was passed by the House in HB 1. Primarily, there are proposed increases in several classes, including Class 10. This is largely to convert some existing full-time temporary positions to permanent positions. Class 22, which is our lease, I think many of you know, we used to be at Philbrook, and then during the pandemic, for unrelated reasons, had to move into lease space, and so we were not anticipating having that cost, but we do. So that obviously is an increase in appropriations in Class 22 to cover the full cost of the contract. Class 3 is proposed to be increased. When we took on the Mechanical Licensing Board, we also took on 5 of their inspectors and 5 of their fully depreciated vehicles. So we need to upgrade those vehicles and change them out, which is why we are requesting additional funds in Class 30. Class 46 proposes a significant increase in consultants. This is largely for the Board of Medicine. We hired an additional physician, or we contracted with an additional physician investigator to assist them with investigations. The Board of Medicine is proposing to change the way it conducts its investigations to be a little bit more efficient, utilizing consultants as opposed to volunteers who have had an issue achieving quorum in the last year or two. And so that Class 46 increase is largely representative of that additional contracted position. And then obviously we have a proposed increase in Class 60 due to the proposed increase in Class 10. And then finally, Class 531 is our professionals health program. That's available to several of our health professions. We already have a dedicated non-lapsing fund for this. We have a contract that was approved by GNC, and so what's proposed in terms of the increase is a result of that approved contract. There is a separate fee that we charge for participation in PHP, and so it's fully funded through licensure fees for those people who are eligible for the program. The proposed new positions are listed on the following page. These positions are filled. So we have 2 business analyst positions, and these positions are really necessary to implement our new licensing solution. I can tell you what we've been dealing with in the past 5+ years is that a lot of the support to our licensing system was provided by staff at DOIT. The state is moving toward a vendor-supported model, which we are fully in agreement with. Right now, we only have 2 part-time workers at DOIT that support the entire licensing system. It's not just used by OPLC, it's used by lottery, it's used by liquor, it's used by HHS. So we often compete for time, and that has caused some issues when the legislature makes changes with the licensing. We can't always implement in a timely manner. So the business analyst positions are definitely necessary to implement a new licensing solution. We have 2 attorneys that are currently assigned to assist with this internal controls project, as well as to provide client counseling to the boards. We have an internal controls administrator who's responsible for essentially trying to help us establish internal controls, as well as a licensing supervisor. I want to talk a little bit about the differences between what the House passed and what was proposed by the governor. The House budget eliminated the proposed funding in Class 59, as well as the establishment of that class. And I think that was largely based on a conversation we had with the House about the fact that we had sought funding in Class 59 to cover the cost of the 6 positions should the House decide not to establish these positions as permanent positions. But I think what we need to do is, what we didn't realize, what I didn't articulate, is that practically it takes a couple of months in order for those positions to actually be converted, and we have people in those positions now. And so I think there needs to be some funding in Class 59, as well as the establishment of Class 59, so that those people can continue to do the work that's necessary for us to achieve our initiatives. The other thing that was not present when we met with the House actually 2 months ago today was that we were not anticipating any delays in our project. We've already seen 3 delays from the vendor in implementing our new initiative, as well as an increase in certain licensing types. So I do think that some appropriations in Class 59 is necessary if we need to provide additional customer support. I anticipate that it's not going to go in the same time frame that we are anticipating, just based on the last 2 months, our experience. Moving on to the following page, I wanted to talk briefly about what is proposed in HB2 right now, just related to licensing. So I think most of you know a lot of the proposed licensing changes was removed from House Bill 2. There is still one proposed repeal in HB2, and that would be of the voluntary licensure of electrical corporations. That would result in just a slight decrease in revenue, projected about $13,000. We also have a proposed unanticipated indeterminate amount of proposed increase in revenue due to universal licensure recognition that is actually in Senate Bill 594, or House Bill 594 rather, and the military service member licenses for electricians, and then the transfer of licensing boards to OPLC. I should note that the Board of Licensing for Interpreters is not presently in HB2. It's just boxing, auctioneers, and bondsmen that is currently proposed to move over to OPLC. We haven't had an opportunity to really look at their books in greater detail, so I don't know what that would mean in terms of increase in revenue. Also, boxing has a taxing component, so we need to take a look at that and making sure that we understand the full ramifications of that. But overall, I think what we're trying to do, in a nutshell, is move away from manually driven personnel, largely driven by personnel processes, to leveraging technology. And I think that'll ultimately result in a net savings to the state. I think what we'll see as we shift away from these manual processes, less of a need for hard labor in terms of processing licenses, and we may see a reduction in Class 60 and Class 10 over time through attrition. This isn't going to happen overnight, but what the office really needs to do is spend some money to get these systems in place, and then we can let staff support fall off on the back end when it's no longer needed. With that, I'd be happy to answer any questions.
Questions from committee members? Senator Bradley.
Thank you. Good afternoon, Director. So in Class 59, you said additional, what are we talking?
So I think for our purposes, we'd like to see a sufficient number to support 3 full-time temporary positions at a Class 15, Step 1. That's currently what our customer support unit individuals make. And I think that should be sufficiently flexible to allow us get through our communication strategy with the migration. That would be approximately, I'd have to do the calculations, but that would be approximately $200,000
Per year?
per year.
Thank you.
Senator Rosenwald.
Thank you. Are the volunteer boards, are they able to have members participate remotely to increase, would that increase participation? I know it's hard to get people to come to a meeting once a month.
Probably.
Yes, I think what we observed during the pandemic when boards were allowed to meet remotely is that we saw an increase in participation. We also saw a significant decrease in our expenses because we didn't have to pay mileage, which we really enjoyed. Yes, I do think, particularly for those who travel far, there is evidence to support that we would see greater participation.
My question was, are they able to?
Oh, I'm sorry, Senator. They can. Under 91A, a physical quorum has to be present. So if a physical quorum is present and you have a good reason, that's not the statutory definition, but they essentially have to state why they're not able to attend remotely, and it has to be a good cause. Then anybody beyond the physical quorum could attend remotely. And they do, but what that means is you kind of have to work it out who's attending remotely and who's not.
Thank you.
Senator Purdon.
Thank you. Thanks for coming in today. Good to see you.
Yeah, thank you. Good, likewise.
Kind of following up on what Senator Bradley asked, because I guess I'm not quite clear on. So line 59 is temporary full-time?
Yes.
So could you explain exactly what that means?
So there are 2 ways outside of the budget process for us to establish full-time positions. The first is an 8T position. Those are positions that are expected to last less than a year, and they don't need governor and council or fiscal approval. They need approval from the Division of Personnel, and then DAS confirms that you have funding for that. If you need appropriations, you need to go to fiscal and move that money around. Then there are 9Ts, which are positions expected to last longer than a year, and that has to go through fiscal and governor and council approval. And so we have regularly used 9Ts to backfill when we need additional resources, and we anticipate that we don't long-term need 8 people in our customer service unit, but as we're migrating, we could need a few additional folks to help fill in. And those would be 9T positions. And we're not asking for permanent positions because I don't think we need them long term. We're exploring other customer service module opportunities. There are some state agencies that essentially have outsourced that. We are looking at that as to whether that would make sense for us. One of the goals being we'd like to be able to provide customer support outside the 8 to 4 time frame. But we have such a huge regulatory structure, I'm not sure that would make sense for our agency. So it's something we're continuing to explore.
Follow?
Absolutely.
So with either of those classifications, would you provide benefits for them, or would they just simply be like contract positions?
Yes, they are benefited. So actually, when I calculated this earlier this morning, there's that position cost calculator worksheet. It was about roughly 65,000 for that position to include both salary and benefits.
One more?
Sure.
I guess I'm trying to understand the benefits portion. What benefits would you be providing? They obviously wouldn't be vested for retirement or things like that because they're not anticipated to be here long enough to do that.
Correct, but they still get the medical and dental, and they still pay in. They still get the same benefits that another full-time state classified employee would get.
Other than retirement.
Correct. Well, right. I mean, you could pay into the system, and it could eventually count if you were in a permanent position for at least 10 years. But that experience would count.
All right, thank you.
And the Social Security would also be part
Right.
of benefits.
Right.
Senator D'Alessandro.
Thank you, Mr. Chairman. The House zeroed you out for full-time temps. And also reduced your benefits line fairly significantly. So the number that you quoted to Senator Bradley, is that a reappropriation of the zeroed out line?
It would be a reappropriation for a different purpose. We had originally sought appropriation in Class 59 to cover those 6 positions, and that's what the House zeroed out because it's included in Class 10, which makes complete sense. What we didn't take into consideration was the increase in the amount of work and the necessary communications that have to happen to undertake this migration back when we were developing our budget and even on the House side. So I think, my understanding is Class 59, I could be wrong, Heather, you can correct me. Class 59 and Class 50, it's essentially a bucket. It's not necessarily for a particular position. We need some sort of flexibility with those part-time and full-time temporary positions so that, number one, we can continue to pay the people who are currently in 90s, and then two, if we need an additional customer support person or two throughout this migration, we have appropriations.
Okay, and the number you quoted was what, 100,000
It was approximately 200.
to 100 each
Yeah.
year?
Yeah, 200 each year.
200 each year?
Yes. Yes, Senator.
200 each year. Okay. When you moved from Philbrook to your new location, there was a bond that was issued to renovate Philbrook for you. Who's paying that bond off?
So there was $1 million. My understanding is that there was $1 million that HHS put toward moving all agencies. There were 4 agencies impacted, and that I think was managed by DAS. That's not something that we managed. We fully paid for the lease, and then beyond the initial, when we first moved in there, the renovations were for just floors 1 and 2, which was about half the space that we needed, and 3 actually. And so when we amended our lease to take on the 4th floor, which was previously Deloitte, we have fully paid for the cost of that.
Okay, so if I might continue, so the cost of the initial renovation to Philbrook is being paid for by somebody, and that was about $1 million or $1 million plus. So that's still hanging, and when they took Philbrook, again, renovated it for transitional housing, so there was $1 million involved in that. So there's a couple of million hanging out there. $1 million, I know where it came from because I appropriated that money as part of the transitional housing. It's the bond that existed for the initial renovation. Who's paying that?
Heather, do you want to chime in? My understanding is that HHS funded the initial move from our offices to Eagle Square. I don't know where it came from. And DAS managed that funding.
We'll have LBA get with whoever they need to figure out your question and get you a proper answer.
Great, okay, thank you.
Additional questions?
Thank you for your time. Appreciate it.
Thank you. And Mr. White, if Senator D'Alessandro is correct, you're going to be part of that conversation about the renovation of Philbrook. We'll start just as soon as the handouts get passed out.
3 minutes early.
Thank you. All right, all the senators had the presentation. We'll welcome Health and Human Services here for the rest of today and tomorrow also. So,
Excellent. Good afternoon, Senators. My name is Nathan White, Chief Financial Officer with the Department of Health and Human Services.
Good afternoon, Lori Weaver, HHS Commissioner.
And before we get going, I just wanted to provide the committee with an overview of the documentation that's in front of you just to orient everybody as we enter into the next 2 days of discussions. So you were provided a document, and there's several tabs in there. The first tab is the budget briefing book. And what that contains is all of the HHS accounts that are over $1 million. And included in there are the descriptions relative to the RSA, the services delivered through those, the population served, as well as some key performance metrics associated with that, as well as an overall general description and background on that. You have also been included within that book the House presentations. The House presentations that we were provided, they were a little bit more lengthy. They have a little bit more detail on the programmatic elements that we'll be discussing here today. Not required reading, but available if you need it. The third tab has been reserved for the presentations that we're going to be handing out here today and tomorrow afternoon. And then I've also included some position documentation. There's 2 key documents in there. One is a document that shows all of the changes from the 22-23 to the 24-25 biennium. And then there's also a summary documentation showing you where within the department the positions lay. And then finally, there's also some supplemental documentation in tab 5 that shows all the legislative appropriations for HHS from the 2022 legislative session, as well as the fiscal items that have been approved. And before we get going, just as a high-level overview of the department's budget, currently the department's budget coming out of the House is approximately $3.26 billion. About 50% of that is federal funds, about 31% of that is general funds, and the remaining 19% is other funds. Currently, entering the budget process, we had 3,213 positions that were budgeted. That was a net reduction of 25 positions. During the agency phase, we had abolished 25 positions. The House did add, and we'll be talking about these today, they did add 3 positions for facilities needs and 2 IT positions that will be addressed later today. Each presentation that we'll be presenting to you, we have included all of the relevant HB2 provisions, all of the relevant HB1 changes that occurred during the House phase, as well as technical changes and other HB2 requests that the department will be making to this committee. And with no further ado, I'm going to hand over the presentation to the Commissioner.
Thanks, Nathan. Good afternoon. So I have the privilege of going over the Office of the Commissioner with you in less than 45 minutes. I will do my best. But to provide a high-level overview, we always provide our mission statement, which many of you are familiar with. What you may not be familiar with is that we are actually, for the first time in decades, going to be looking at our mission statement this year as part of my roadmap initiative to be bringing it up to where we are today. Even though this mission statement will suffice and does stand, I think we can do some work on that. So that's news that maybe you didn't have before, and we will hopefully be able to share that next time. The org chart for the department at its highest level for the Office of the Commissioner, when we think about the department's really large from a leadership perspective, this is pretty much how we break it out in terms of at the commissioner level. If you look over to the left, you'll see the deputy commissioner position, and underneath that are all of our operations. This was the position that I had prior to stepping into this one. So we have, those will be covered in this presentation. If you go to the right, you'll see 3 associate commissioners. That's our policy areas, and our divisions are all underneath that. So that's where a lot of our policy work is located. And then underneath that are additional administrative support areas, such as our chief medical officer, our CFO, our CLO, and as well as some of our 24/7 facilities and licensing and regulatory. So that's a way to try to capture it all in one page. If you would go on our website, there's pages and pages that break each of these down should you choose to go further. One of the things I just wanted to share with you here and how it plays into our budget a little bit is that when I took this position of interim commissioner, one of the things that we decided to work on was a roadmap. So it's like strategic planning light. With 14 months to get to the end of February of 24. Point is, what could we be doing and staying focused? It's a high-level plan that highlights key initiatives, but also brings some additional new ones. And I'll go over what those are in a minute. But it's really about focus and accountability. And if we can do this in 14 months, I would like to think that in February of 24, that it's a good bridge to some longer-term strategic planning if the department can be disciplined to do that. The next page with all the bubbles is really the high-level visual of our roadmap. When we chunked it out into 4 various commitments, those are the bubbles. You'll notice that the biggest bubble is the blue bubble of invest in people and culture. That is the number one thing that we're trying to focus on in the next 14 months is building back up our workforce. Much like other state agencies, we were decimated with positions. We had a high of 22% vacancy rate. I would be happy to tell you that 18.6 is what it was last week, so that's an improvement. 18.6 is still high, though, and equates to a lot of vacant positions. So we're working on focusing on getting those positions filled as well as retaining people, thinking about our culture. Why do you want to work at the department? Why would you stay? We can't do the work without our workforce, obviously, so that is the first and foremost. The other bubbles really speak to some of the work. So if you look at promote thriving communities there on the right, that is a lot of our work that we're doing right now with our behavioral health continuum, which includes things like the rapid response model that we're working on enhancing, crisis stabilization services, and there's a plethora of items under there, but really focusing in on that. JJ transformation, which is really keeping kids out of the system, community-based care, prevention care. And also our Medicaid system, our model of doing some evaluation on that. The bottom circle, enhance organizational value, this is really our return on investment. So this is a division that we're basically elevating up, was created right before COVID hit through executive order. DPQI, that stands for the Division of Program Quality and Integrity. It's such a mouthful. But DPQI is our ROI. Are we actually... The money that we're investing into the programs that we are getting and services that we're getting isn't making a difference as it's intended. So this is looking at not only evaluation, but it's also looking at contract lifecycle management. So when we have new services that come up, are we working with those that we partner with even before a procurement goes out, not just during and after? So that's focusing on all of that. And the last one is obviously managing resources effectively and efficiently. We have to. We just don't have enough resources to do the job. So we have a leadership governance that with every new priority that comes in will be vetted against our goals, will be vetted against what resources that we have. And another one that's in this area is just operational efficiencies. You may have noticed we are in the building business lately. We're building a forensic hospital, we have a Hampstead hospital, and we're looking at building a YDC. So we need to bring some operational efficiencies to that, those processes as well. So those are I share that because it does play itself out in the budget and it does play itself out in terms of our priorities. questions on that before I?
Senator D'Alessandro.
Thank you. This is the first time in a number of years that buildings have entered into the picture. Really since the the first Sununu administration where we built the New Hampshire hospital. So you mentioned the hospital, is that the hospital that Southern New Hampshire is putting together?
Well, when I said hospital, I was referencing the forensic hospital, but yes, we also do have another hospital, but we are not physically building that ourselves,
Okay,
yes.
so you're talking about the addition to the New Hampshire hospital, which is the forensic unit?
Correct,
Talking about the building of the new Sununu Center?
yes,
Okay, and the maintenance of Hampstead Hospital, that's in the mix. So we have.
it is.
So in terms of building, monitoring expansion, we've expanded both in the building phase and the monitoring phase.
Yes,
Okay, great.
Yes. a little bit in the renovation phase as
Right,
well.
Right,
There's
and
some
the
of that.
The renovations at New Hampshire Hospital, they're ongoing, are they not? I mean, the building out of the rooms that was.
Yes,
Okay.
yes. So, and as well as at Hampstead Hospital, we are near completion of a psychiatric residential treatment facility wing at the hospital, so that was a renovation as well.
Right. Okay, thank you, thank you.
Additional questions? Back
Great.
to you.
So, slide 6, I'm like, where's the number? This is just in terms of, Nathan talked about, when I started with the department 25 years ago, we had over 3,400 positions. Obviously, we don't have that many today, and you can see with the filled line versus the vacant line, since fiscal year 2021, our filled positions keep going down and our vacant positions keep going up. I would like to see in a year that we get that going down, the opposite, that we have less vacancies and more filled positions. But it's just, when we think about all of the work that we have to do and the resources, it becomes a super challenge, and it obviously creates delays in a lot of the work. People often ask, why don't you move faster? Why don't you get things done faster? Resources and staffing are definitely a reason why. So Nathan and I took the Office of the Commissioner for slides 7 and 8. It's intuitive to me to be in the corner. And took each one of these and broke them down. And we didn't want to spend an inordinate amount of time going over each of them. I think Nathan has referenced that we did provide some materials that do a deeper dive. However, I'd be more than happy to take any questions. But when you look at, we have Bureau of Human Resources, we have Legal Regulatory, Office of Health Equity, our Bureau of Information Services, which is not just IT, it is information services for all of our divisions and facilities. We chunked out what were the major areas covered, or breakdown components, if you will, of each of those areas. And then we have the accounting units on the bottom. So I guess if there's questions on that, I can dive into that.
Looks like we're good.
Okay, you're going to help me finish this in time. And the
I'm
subsequent.
sure that we'll have conversations ongoing.
Oh,
throughout
I'm
the
sure.
process.
The slide 8 is a division of, which is what I was just mentioning, program quality and integrity. That is one of our roadmap commitments, and you can see throughout there that you have the contracts, quality management, Medicaid quality strategy, data analytics, provider oversight for Medicaid fraud, audits, financial reviews, all really important stuff to help us maintain integrity with all of the work that we're doing. Division of Finance and Procurement, that's the division that Nathan oversees, our finance, budgeting, federal reporting, contracting, and grants management. We also have, some of you may or may not know, we have employee assistance. Although it's a statewide program servicing all state agencies, it is housed within Health and Human Services and serves as the legislative, executive, and judicial branch. And then we have our Public Information Office for the department with media relations, constituent, and public awareness complaints, it is complaints, but campaigns as well. So that is the overview of Office of the Commissioner and the various components as they relate back to that first slide. If there aren't any questions on program, we can move right to the numbers.
Excellent. On page 9, before you, we have the different areas of the department wrapped up at the activity level. The first line there, the 9,500, the subtle change that you do see there in state fiscal year 24 to 25 and 25 between the House and the governor's budget. This was a technical correction where we increased the copier costs as a result of a new statewide contract where the costs had increased. The Office of Improvement and Integrity, the 951010, below that, there were no changes from the governor's to the House phase. Under legal and regulatory services, I'll be speaking about this in a couple of slides here. There were some changes to the Prescription Drug Affordability Board that occurred during the House phase as well, where they took out the ability of the board to collect fee revenue, and they added $250,000 of general funds. But otherwise, there were no changes in that area between the two phases. At the activity 9530 on page 10, this is the Office of Administration. This is where we have two accounts for facilities that fall within this. There were 3 staff positions, we'll be talking about this here in just a second, that were added to address some shortfall with resources relative to positions that were previously provided by DAS for the department. The Office of Information Services had no changes within House Bill 1 from the governor's phase to the House phase. And then the quality assurance and improvement there at the bottom, there were no changes at that stage. On page 11, there's a little bit of detail here on the House changes. The first major item there in HB 1 Section 7, and I see a typo there, the House introduced a $23.4 million back of the budget cut. This provision also limits the department to hiring no more than 3,000 positions out of our 3,213 that we currently have. They did mirror the language from the current biennium that requires we identify by September the class lines from which we are going to cut those dollars by September 30th. The challenge here is that they did remove the language that limited it only to positions to allow us to make those back of the budget cuts with contracts. But if we have to identify those costs by September, we're not necessarily going to know which contracts are going to spend, because we basically have to identify those before the beginning of the first quarter ends. So we will be making a request for some modification to the language. We still do believe it's important to report that to the fiscal committee, but perhaps with a little bit more flexibility so that we don't have to only cut from personnel lines to hit that back of the budget cut. The next item there, this is the management support. This is the facilities item that I just spoke to. Back in 2005, an MOU was required by state law, and it was entered into between the Department of Administrative Services and the Department of Health and Human Services for support at the state grounds at the Governor Hugh Gallen State Office Park. In the last HB2, that section of law was stricken, and since then we have lost 6 or 8, approximately 7 embedded DAS resources that were previously at the Brown Building. The House added funding to provide 3 positions to backfill those resources that we no longer have. The next item is the $19,000 for increases for copier printer expenses. The following item is the Prescription Drug Affordability Board. As I said before, there is both an HB2 and an HB1 provision associated with this. It's sections 389 through 393 of HB2, where essentially the continually appropriated non-lapsing authority of the Prescription Drug Affordability Board was removed, as well as their ability to collect fee revenue. Previously, they were planning to collect up to about $450,000 of fee revenue. The House modified the budget there and appropriated $250,000 for that purpose. And just for clarity, the Prescription Drug Affordability Board, it is an administratively attached board to HHS. HHS does not have direct oversight of the operations of that particular board. Finally, sections 413 through 15, this establishes a data privacy and IT security governance board and established 2 positions. Funding was appropriated for the equivalent of 1 full state fiscal year. The following section, these were the sections relative to the designated receiving facility beds. Those were stricken by the House from HB2. And then finally, historically, in HB2, DHHS has had the authority to fill unfunded positions. That has always been chapter law. The House, they changed that to be permanent RSA. And they made that change. It's included in HB2 in section 188 as we speak. On the following page, on page 12, these are the areas that we are requesting the committee consider. The first section is what we already discussed relative to the language concerning the back of the budget cut and a little bit more flexibility on the timing of the identification of the class lines that will be required to cut. The second item, the House, the governor had funded an appropriation for IT consultants. Currently, we don't have the matching federal funds included in the budget. We would request that the Senate would either consider adding those to HB1 or adding a provision to HB2 language to allow us to accept those funds without fiscal committee approval, similar to what we do for many of our Medicaid dollars. The next section there, the Healthcare Facility Workplace Violence Prevention Program. In the governor's budget, this program was suspended. The department does not have any resources currently to implement that. There are a variety of requirements relative to data collection, analysis, website, and administrative rule facilitation required of the department. The House, in lieu of potentially adding a position, they essentially, within the HB2 sections 200 through 203, what they did was they made all of the requirements optional for the biennium. If those sections are deleted, the department would request a minimum of 1 program specialist, 25 labor grade 25, to allow us to implement the program. The following section, a number of years ago, probably 3 or 4 years ago, RSA 94.1 more. Okay, commissioner's correcting me. Longer. Allowed the Department of Administrative Services to charge the department anytime they conduct a review for the Joint Commission on Employee Classification. The Department of Administrative Services has been allowed to charge the department, but only recently have they started to charge us. In doing so, what we discovered is the way that the law is currently written, that the funds must be paid for out of an existing class line, salary line. The problem there is that we budget our salary lines to the position we don't have those funds. Our request is to allow us to pay for that out of an existing appropriation, a small modification to that section of law, and I've spoken with the Department of Administrative Services about that. The following item here, the Data and Privacy and IT Security Governance Board that was established within Section 414 requires, there's a certain timing requirement relative to March 31st, 2024. The problem is we need the positions that were appropriated through the corresponding section, but we only have funding for 1 year, and this first requirement takes place in the first year, so we would request that could be modified to go to 2025 to be consistent with the appropriations. On page 13, there's 2 budget areas for consideration. The first, we'd like to return approximately $1.4 million, about $950,000 of that are general funds. We've gone out to contract, and we've determined that the original budgeted amounts are over budgeted. The bid came in lower, which is great. And then the second item there, and there's a corresponding item that we will have in the New Hampshire Hospital presentation, is to move a position to New Hampshire Hospital, and there's a corresponding figure within the New Hampshire Hospital for that. The House Bill 2 sections that were included within the governor's budget that were also approved by the House, there's a provision for the department to have the authority to transfer between certain classes. That's been, you could consider that to be boilerplate language for a number of biennia now. One that's slightly more complex, the health facilities licensing inspection, section 199. The department worked with the Department of Safety during the agency phase. We abolished 2 of our positions, and the Department of Safety created 2 corresponding positions, so it effectively had a net 0 impact. And that was this section here. This strikes the authority of the department and our responsibility relative to inspecting healthcare facilities, particularly around fire and safety, because the Department of Safety already does similar work, and it made more sense to have them be responsible for that, and the governor's office agreed, and so that was done during the governor's phase. There's also a section with our authority to transfer between personnel class lines that was approved and continues. We also have a HB2 section there that would convert 32 of our DCYF attorneys to unclassified positions to better meet the demands of the job. Typically, their schedules do not follow the 37.5-hour work week, as they may need to be in court, and they may need to prepare in advance the night before, and that was approved by the governor and the House. We also have a section in here for a district office move, $533,000 of general funds. There are two sections here. They may seem similar, but they're quite distinct. We were appropriated $1.5 million within the House budget, or HB2 as amended by the House, or excuse me, HB1 as amended by the House. $1.5 million is for the analysis of IT projects, and $1.95 million of general fund is to actually implement those solutions. So the first is funding to hire external consultants to conduct the analysis of the systems and business requirements. The second one is to actually implement it and make that happen. And those are new needs of the department. We have had a hard time hiring within the IT realm, and this would allow us to identify and capture the resources necessary through contracted services to implement key systems automation to better utilize time and money. Finally, there is two more sections. There is an appropriation of $125,000 to replace an old eligibility database, and then finally $410,000 was appropriated to replace switches, routers, and wireless access points at DHHS offices. So that, in a very quick nutshell, is all the changes and the requests that the department have within the area of OCOM.
Questions? Senator Bradley.
First of all, congratulations. As somebody who's chaired the Health and Human Services Committee for a long time, I just have to say, you have great staff. I really appreciate the hard work that all of HHS staff.
Thank you.
does. So,
I would concur. We have great staff.
all right, a couple of questions, especially on the page 13. What is the proposed office move?
The district office move, you may or may not have heard, but Claremont has flooded. We've been closed since February 6th. We've been trying to vacate that property. Commissioner Arlinghouse and I have been having that discussion for years. So it looks like now might be the time because we kind of got flooded out. So I'm hoping to make that move. We also have Laconia lease expiring at the end of this year.
Just wanted to make sure it's not Conway because that was really controversial a few years ago when you entered into
It's not Conway.
a 10-year
Conway's looking
lease
good.
with Colonel. The DCYF attorneys, that was also a big hoorah a few years ago.
Yes.
Have they bought into becoming unclassified?
We've been working really closely with Deanna Baker and her team in terms of communication and explaining the rationale behind this. I would say, are they completely bought in? I with 100% certainty can't say that they all are, but I think they understand. There's been communication since last session about we are moving to this and why, and in that it is really business driven and trying not to cause any harm to the employees whatsoever.
I mean, I heard about it hugely whenever it was, I think 2 years ago maybe. Haven't heard a thing now, but just want to, before we do it, verify that.
It's not a secret. Yep, we've been talking about it with them. Yes.
getting to the vacant positions, we've made a huge effort to increase caseworkers for DCYF, but they've been hard to fill. So, you know, where are you in that regard? How many caseworkers are there and how many unfilled positions?
Do you have that at your fingertips? We can get the exact
Okay,
numbers. I mean,
all
we're
right,
talking
that's
with
fine.
Joe Ribson. I know that we are hiring. The problem is quickly as we're hiring, people are leaving. So,
Yeah, no,
yeah.
and it's been the case since we've authorized, I think it was in 2019,
Yes,
I don't know, a lot of, almost 100 new
Yes.
positions. So I'm not sure if I should ask you this question or later on, but I'm gonna ask it anyway. Obviously, there's litigation between the state and the hospitals in an attempt to resolve that. I guess I would like to know that the budget proposal that we have in front of us gives all the resources you need to get Hampstead up and operating as quickly as possible.
Hampstead and
no.
other resources, correct? Yes,
that?
and other resources as well. We just had the Senator D'Alessandro reference Solution Health Hospital, so as well we have those resources
Right,
as
so-
well.
So that is included in,
Yes,
okay. And in terms of, I believe there are 24 beds that have been closed at New Hampshire Hospital. There was obviously a flood there, but I mean, is it a priority to get those beds up and staffed? And do you have the resources to do that?
it's definitely a priority. The water damage is being worked on right now, and basically concurrently, we're also renovating that space while it's vacant. While we can't open it because of staffing, we're taking advantage of getting that space ready and then aggressively recruiting to be able to, at the end of that renovation, start to open up those beds.
And this budget proposal gives you the resources you need to fill those positions as
Yes.
soon as the renovation is complete.
Yes.
Okay. And another thing with regard to, you know, what people have talked to me about, do we have enough transition beds so that when people are ready to leave New Hampshire Hospital or the DRF beds, they're able to transition back into the community?
I would say we don't have enough right now and that we need to be working on.
does-
Well, when I say we don't have enough, we have providers that have beds that can't fill them because of staffing issues. So that's not to say that we haven't built the beds or built the capacity. It's just it's not being able to be utilized.
And is that a resource issue that we need to address?
Well, it is when it comes to rates.
And we'll get to rates, I'm sure, at some point soon. Okay, I'll stop there. Thank you.
Senator D'Alessandro.
Thank you, Mr. Chairman. Just getting back to Senator Bradley's conversation, we did appropriate money for transition beds. You used a portion of that money to renovate Philbrook, right, and created 16 transition beds. Is that correct? Are they all occupied at this point in time?
Yes, they are occupied.
So we have the ability to move 16 people out, and I'm sure that they're coming and going, right? You got some that you want to move in, but you got some moving out.
Yes, I mean, I think the challenge right now, Senator, with the PATH program, with the 16 beds, is some of those folks that are in those beds aren't ready to go into the community.
Yeah, sure.
And there are some, but the beds aren't available in the community because of staffing.
Okay, but we did appropriate $5 million for that, and there was some money used in the build-out phase.
Senator D'Alessandro, are you referring to the HB2 provision that was concluded this past biennium?
This was the biennium before that.
Okay, I know that tomorrow Katya Fox with the Division for Behavioral Health, she's going to start, and then Ellen LaPointe with New Hampshire Hospital. I know they're both going to be addressing these questions, and we do have a couple of items associated with them to
Sure.
discuss.
And I recognize the fact that the COVID situation was problematic in terms of doing some of the things that we had asked you to do in that budget process. When I look at your proposal on page 13, this is 219, 221, 223, 225. Are these asks? that are not in the budget that was done by the House or the governor?
So-
Are these funded?
These are the sections that were included in the governor's budget that were also approved by the House. So what I tried to do in every presentation is identify all of the HB2 provisions. So they'll be included throughout the presentations over the next 2 days, just to make sure we identify those to be fully transparent.
Great, okay. And further question, but the district office move, the 500,000, that's not funded or is funded?
That is funded.
is
Everything
funded.
here is funded.
So, all right, so we've covered all of these bases.
Correct.
Okay. And when is that move gonna take place?
Within the biennium.
Within the biennium?
Yes, we are close. I don't want to jinx myself.
Okay, great. And the Manchester operation is still on Perimeter Road?
Yes.
That's pretty tough to get to. You have to go way out to Perimeter Road to get to the office. If you don't have a vehicle, there's no transportation, right? The bus doesn't run out there, I don't think, unless they've started something that I don't know about. But that's been a
I think the bus
concern.
does run out there, but
Does
it is at the end of the airport.
Right.
It is
it's-
hard, yes.
Okay, great. Thank you, Mr. Chairman.
Senator Rosenwald.
Thank you, Mr. Chairman. Looking at the provision that the House took out of House Bill 2, Sections 282 to 284, I know that during the last year or two, we appropriated through fiscal a significant amount of money to build out our DRF beds. Were any of those beds actually established at any of our hospitals or in freestanding centers?
Well, recently we did have 5 beds that just went through council for Dartmouth Hitchcock. For Dartmouth Hitchcock. So that will bring on. That was from that money, the 5 additional beds
Okay, so we got 5 additional.
from the hospital. Yes.
Thank. Ask a follow-up. In these sections of House Bill 2 that the House removed, how many more DRF beds would have been created if that had stayed in? 50?
Approximately 60.
60, and we got 5. Okay, thank you.
Senator Bertzel.
Thank you, Mr. Chair. Thank you for taking my question. Referencing the question that Senator Bradley was asking about Hampstead Hospital, is when you're talking about Hampstead Hospital, are you talking about the current renovations that they're doing now? Or the potential for the Sununu Center moving there?
I was answering, I believe, into current facility for Hampstead Hospital now, today.
So the reason I'm asking is we did a tour on Friday and it shows that there's a renovation for, I think, a level 5.
Yep, the PRT,
And that should be ready at the end of
May.
Do you have staffing for that?
So we contract with WellPath Recovery to run the hospital, so they have been recruiting staff for that to be able to open beds and get up to the 12 within a certain period of time. So when they open at the end of the month, I don't think they're opening with 12 right off of the bat. I think it's a gradual increase, but within a relatively short period of time, yes.
Okay, thank you.
Additional questions? Seeing none?
Thank you.
Yeah, we actually got a few minutes early.
Yeah, no.
And Kevin is handing out the presentation and the sections in the back relative to what the House approved, what the governor included that wasn't approved by the House. Those will all look identical. And in the Compare House to Governor document that you all have in front of you, the Public Health Services begins on page 1188.
Good afternoon. Good afternoon, Chair.
Good afternoon.
Thank you all for the opportunity. My name is Tricia Tilley. I am the Director of Public Health. Thanks for having the opportunity to run through some of the highlights of the Division of Public Health budget. If you have the slide deck in front of you, you can skip to slide 2. That is our mission. As we started with the department's mission, we are starting with the division's mission as well. One of the things that makes public health a little different than some of the other programs in the department is that our work directly benefits the health and safety of everyone in New Hampshire. Every baby that is born, everyone that eats in a restaurant, everyone that needs to seek health care, everyone who wants to know about the health status of New Hampshire residents, everyone who doesn't want to get sick from their water or from getting a mammogram. And then we focus particular attention on groups of people who've historically not been included or considered when developing those systems of care. You know, generally those are low-income populations. But we don't do this work alone. We do it in partnership with the health centers, with the hospitals, with our community organizations and our advocates. And to do that, we have 1 million contracts out in the community with providers and organizations. That's our long way. That's my long version of the mission statement that's on page 2 or slide 2. As slide 3 shows, we organize about 270-ish staff into several bureaus within the Division of Public Health. New for this upcoming biennium, we are splitting what is currently known as the Bureau of Population Health and Community Services. We're splitting that in half into 2 bureaus so that we will have Family Health and Nutrition, which will be our MCH, Maternal and Child Health, and WIC programs, and then a Bureau of Prevention and Wellness, which will be our chronic disease, cancer, tobacco programs over there. We're doing that because the body of work within that one bureau is really enormous. The number of contracts, the number of budgets, the number of federal grants, it really makes more sense to split those up. We can scoot over to slide 4, and I think that this is perhaps a more useful way to think about the breadth of the work that we do. If we start with things like protection, this includes our emergency response functions, all the way to things like food safety, not only of restaurants, but of dairy farms and milk distribution. We then look to scientific evidence to inform our strategies. This is where places like chronic disease excels. We know that things like diabetes self-management are effective supports and that there are effective supports to help people stop smoking. All of these things not only improves individuals' lives, but it also saves the state money in the long term through Medicaid, through long-term care costs. Prevention is at the heart of everything we do, whether that's to ensure we have a strong primary care system, strong public health infrastructure, or ensuring that all kids and families have access to no-cost childhood vaccines. You'll hear a lot about data as we go through our budgets and our programs. The numbers are always behind what we do. I hope you've all spent some time on our New Hampshire DHHS data portal or read some important reports that we've sent out, like the report that we recently did on excess rates of cancer in Merrimack as well. Very important stuff. And finally, at the end of the day, it's all about improving health outcomes, whether it's preventing adverse childhood experiences or using sort of quality improvement methods to make sure our preventative screening programs are timely and improve health. Some of the big key budget takeaways on slide 5 are we have about $130 million in the Division of Public Health, not a huge budget. Approximately 15% of that comes from general funds. The rest is federal and some other funds as well. We have over 50 different federal grants and more than 80 accounting units. And because of this heavy reliance on federal grants, we use both a mix of temporary and full-time staff. On slide 6, we can get into a little bit more of the detail into some of our bureaus. Slide 6 is our Bureau of Public Health Informatics and Statistics. Data is the power behind all of our work. We work closely with the department's Bureau of Information Services and the Department of Information Technology to run the informatics and ensure that our statistical analyses are accurate. Again, I hope you've all had the opportunity at some point over the past 3 years to take a peek at that COVID dashboard. That provided real-time daily updates on COVID for the past 3 years. But in addition to that, we have just depths of data available, transparent to the public from everything from cancer to heart disease to environmental threats. Most importantly, the Public Health Statistics and Informatics Group ensures the privacy and security of our data using strict governance rules and role-based access. Our Bureau of Healthcare Access, Equity, and Policy on slide 7 ensures that all people in the state, whether you live in Pittsburgh or Portsmouth or Manchester or Madison, that they have access to healthcare and services. This is where our Rural Health and Primary Care Program is, and many of you know that and have been supportive of things like our state loan repayment program to ensure that we have a workforce ready to meet the needs of our state. Also within this bureau are some other things like the Prescription Drug Monitoring Program, which you'll recall last biennium was moved from OPLC into Public Health. It resides there now. And then we continue to run the Therapeutic Cannabis Program for about 13,000 New Hampshire residents. On slide 8, the Bureau of Public Health Protection provides both a regulatory arm as well as some data prevention, prevention services to reduce the health impact of known environmental exposures. Food protection not only provides, the restaurant health inspections around the state, because of these folks, we can eat out, we can enjoy freshly made ice cream, all without worry that we'll get sick. We have radiological health, or RAD health as we call it, that ensures that all of the radiological equipment in the state, including x-rays, mammograms, other health providers, that those things are working. Nobody wants to be zapped. We also do monitor air and water around Seabrook, again, for radiological health. Healthy Homes is lead poisoning prevention, and environmental health tracking takes all of our health data and overlays it with known environmental hazards to help us understand the impacts of things like radon in our water. Slide 9 brings you to the Bureau of Family Health and Nutrition. Our WIC program serves about 12,000 families or 12,000 individuals, women and children around the state. You may have noticed, those of you who are on fiscal, that as the result of the pandemic, USDA has begun to modernize and invest further in the program. So we've had some additional funds so that kids and moms have access to that nutrient-dense food. You'll recall at this time last year, there was an infant formula crisis where there was no formula out there, and this program really went above and beyond to not only take care of the families in WIC, but quite frankly ran interference for everybody in the state, making sure that those families could feed their infants. It was an incredibly challenging time in the middle of a COVID surge when families simply couldn't find food to feed their babies, and our program was there to help. Through the maternal and child health section, we do a million things supporting the safety net network of federally qualified health centers. We fund their primary care, their prenatal programs. We do voluntary home visiting programs, family support activities. In this program, it's their responsibility to use that data to better understand how to prevent maternal and infant mortality. You may have heard in the news recently, maternal mortality is going in the absolute wrong direction. And this group within maternal and child health really uses our data to ensure that we get the resources where we need it and provide the support to our providers so they're taking good care of moms and babies. As you scoot through, I'm trying to go as fast as I can on this. Slide 10. Is our Bureau of Infectious Disease Control. These guys were front and center for the past 3 years. They have been working nonstop, just like so many others. We had just shy of 3 million COVID vaccines that were administered over the past 3 years that were all organized through our Bureau of Infectious Disease program as well as our Emergency Preparedness program. We had almost 400,000 cases of COVID and over 3,000 people have died. Meanwhile, we stood guard against, emerging brand new diseases, because what could be more fun in a pandemic than to throw in a new disease while we were at it? So we had Mpox last summer, took care of that. Our numbers were low in the state. We hope to keep it that way. We've also dealt with newly emerging things like highly pathogenic avian flu. Again, that's been in the media. That impacts wild birds as well as domestic flocks and has the potential to jump from animal to humans. No one wants that to happen. And then we stood guard against some old favorites like, syphilis and gonorrhea, which also are going in the wrong direction right now. And luckily, New Hampshire compares favorably to the rest of the country, but still the trend line is absolutely going in the wrong way. We have a team of nurses, epidemiologists, and folks that assist hospitals, long-term care, even corrections, all with infection control practices. Slide 11. So you can take, hand in hand with our Infectious Disease Bureau is our Public Health Lab. It is Public Health Lab Appreciation Week as well, so I'm sure you're all appreciative of the work that they do. While all of us may get our own care at your doctor's office, you get your blood drawn, the Public Health Lab does the work that the individual healthcare systems, quite frankly, don't want to do or can't do. We have three main responsibilities: to be available and prepared for any type of crisis, new and emerging diseases, for product or food contaminations, and even for terrorist attacks such as anthrax or other poisonings. That's what the lab is there to stand guard for. The pandemic was probably the best example we all know. Prior to the pandemic, we averaged about 40 samples a day at the laboratory. And at the height of the pandemic, we were testing over 2,000 samples a day. And so we were able to scale up to that with the help of temporary staff. And we did that because there were no commercial options available left for our long-term care facilities and other providers. The lab also works hand in hand with food protection and, again, our friends in infectious disease to assure that the food that you eat is safe. We all want that. We routinely test dairy, shellfish, seafood. We even test maple syrup, make sure there's no lead in it. And finally, the lab is a safety net for any infectious disease testing we need. We work with the Department of Safety and Fish and Game to do rabies testing for animals. We test for tuberculosis and sexually transmitted infections, especially in partnership with infectious disease. And we're there for any sort of new emerging disease that may pop up. To do this, we need state-of-the-art lab equipment. It's expensive and highly trained staff, all of which are supported with state and federal funds. Slide 12 is new. This is new to DPHS in the past biennium, our Bureau of Emergency Preparedness, Response, and Recovery, again on slide 12. This is the team that ensures that we're ready for anything. They were on the front lines of the pandemic, setting up vaccine sites, testing sites. Last year, we had a booster blitz where this team and community partners arranged for over 10,000 vaccines in one day, and then did it again 2 weeks later with another 10,000 plus people in one day. They currently manage our telehealth programs, which I know have been supported by folks in this room, for COVID therapeutics, and our vaccine van, which is winding down its services. They're going to be working with the Department of Safety's Homeland Security on a detailed after action report to do a thorough postmortem of what happened during the pandemic and what we could do better next time. And finally, the last of our bureaus is on slide 13. That is our new bureau that we're proposing, again, the split bureau. This one is the Bureau of Prevention and Wellness. In this place, we are really focusing on chronic disease prevention. In everything we do, as I mentioned, we look to evidence to inform our strategies, and this is where this bureau really excels. We know that about 6 in 10 Americans live with at least one chronic disease, whether it's heart disease, cancer, diabetes. We know that things like diabetes self-management offer effective supports to get people healthy and well and save money at the end of the day. We know that almost all chronic diseases can be prevented by eating well, being physically active, avoiding tobacco and excessive drinking, getting regular health exercise and regular screening. All of that's important. That's the part where some of us think we nag the world, but those are all the public health strategies we keep promoting over and over. This new bureau uses mostly federal funds to address this wide burden of chronic disease. Everything from setting up oral health clinics in schools to activities that support individuals with arthritis to the prevention of, and as well as the prevention of heart disease and stroke. So now, let's get to the numbers. That was my long introduction. Slide 14 starts getting us to the numbers. Slide 14, you're going to see the budgets for the Director's Office and the Bureau of Healthcare Access Equity and the Bureau of Policy and Bureau of Public Health Informatics. No changes between the governor's budget and the House budget on those. Easy peasy. Slide 15 contains the budgets for public health protection, the Bureau of Family Health and Nutrition, and for infectious disease. There are some changes here that are difficult to see, but we'll go through those highlights and then we'll wrap them up again at the end to go through those. So for example, you can't see it here at the high level numbers, but the House added an additional $30,000 for overtime for the Bureau of Protection for our food inspectors. They go through seasons where they really need more time in the community. For example, summer, you get all the boardwalk restaurants, all the pop-ups. We end up needing overtime, so that overtime was added. In the Bureau of Family Health and Nutrition, the House added an additional $300,000 of general funds so that we could increase the number of families that we could serve. This is also being used as a match to some new federal funding that we anticipate will be landing soon. Also in the Bureau of Family Health and Nutrition, there was a decrease. The only place you're going to see a decrease is in the family planning program in the Bureau of Family Health and Nutrition. And in that case, the House decreased the federal dollars, not the general funds, but the federal dollars, to make it more accurate to what our award is going to be from the federal government. We had that the department and the governor had put forward a number that was increased from what that award amount would have been. That would have helped with things we knew we were going to have carryover. The House moved it back down to the actual amount we will get each year. So if we have something like carry forward, we'll need to go back to fiscal. I think that's everything on that page. We can go to slide 16. Again, there are no notable differences on this slide, I think, between the governor's and House phases. So on slide 17, we have a full list, slide 17 and 18, of all of the House changes. Again, you'll see this talks about the $17,000 or the $30,000 for the Bureau of Health Protection for overtime. It was a mix of both general funds and other funds. The reduction for family planning, the addition of $300,000 for home visiting, and some changes that have zero impact just between class lines. I'll pause there if there's any questions.
I don't see any.
Great, love it. Slide 18 is a few more changes, again, that have little net change to the budget. So we have, we're just moving some appropriation lines in our lead poisoning prevention program. We are adding some revenue from the trustees of Dartmouth into our newborn screening program and changing a part-time position to a full-time position using other funds. That's a slight change that you see. In family and nutrition, again, we are accepting some new positions from the Department of Justice. They're coming in, they're funded through a public health grant. Those positions have been sitting in DOJ for years. We oversee the whole grant. It just makes more sense for them to sit with us internally. And so that was at the request of the Department of Justice. We said, sure, there's plenty of room, move them on in. And then finally, we're doing some other changes that have no fiscal impact within our WIC program, just changes in some lines. All right, super. So slide 19, again, this is the last bit of changes that you'll see here. Family and nutrition, again, some changes to accept some new funds, put those in the budget. Bring in some carry forward funds, again, a technical to bring in funds from federal grant that we know that we're going to get in both tobacco and chronic diseases. And then the final thing we wanted to bring your attention to was something that was in the governor's budget, but has been of note at the House, is something called the Choose Love program. This is a program that was housed within the governor's office, but really sat within the Department of Education, sort of functionally. It is a successful social and emotional learning program and character development program. It's worked with schools and corrections and other institutes to Its notion is to create safer and more loving communities. The original program was developed by a mom who lost her child at Sandy Hook Elementary. So she had lost her child to gun violence, and so she has worked with a number of researchers to develop this program that can be used in educational settings and other settings to really promote this notion of gratitude, courage, forgiveness, compassion, the sort of things we probably all could use more of. And so that program is being moved within the Division of Public Health Services. Great. So slide 20. This is where we come to you with more asks. We have just a few of them on our list. Number one is $300,000 for our WIC Farmers Market program. This is in alignment with Senate Bill 233 that you might have seen, and this would allow us, with the additional general funds, to utilize new federal resources to implement farmers market vouchers for our women, infant, children's feeding program. So the way that it would work is we'd get more federal money. Our families would get a benefit that they could take to a New Hampshire farmers market and be able to purchase fresh fruits, vegetables, local grown vegetables for their kids and for pregnant women. We're really excited about the program. We actually did it a long time ago. One of the benefits of being in the state for 150 years is I remember the first time we did this. Yeah, and it was a great idea, but it was technically hard at the time because we were doing it on paper vouchers, like you'd have to take a piece of paper. Now, with the advent of just a card, we have a WIC card now, and everybody at the farmer's market has their little scanner. This can be done really easily now. So we're looking forward to the opportunity for you to consider us to have the matching funds so we can access the federal funds to do this program.
Absolutely.
Thank you. So on this program, I know in the past, as you talked about with the paper copies, there were only certain vendors who could accept these. So is any vendor there who can accept a credit card now going to be eligible, or do they have to sign up for an account with HHS in order to accept these?
So they will have to sign up, but the process is like 100 times easier now. They will sign off. We will have an agreement with them because we need to do that just for tracking money. But we will be able to work with them. And quite frankly, the farmers markets are more organized now than they were back then. Mm-hmm. So we're going to work with ag and others to make sure that we've got all of that. So it's as easy for the vendor as possible.
Follow. So every individual vendor has to sign up, not the farmers market as
I will get confirmation on that. My understanding is that it's every vendor, but we'll confirm that with the program with you.
And so they'd have to have a tax ID number in order to do this.
Likely, but I will follow up and get the exact information. Great. The other things that we're asking on this list today is to help us work with the Department of Environmental Services. They have some funding through their groundwater trust funds to help child care mitigate lead in drinking water. We have relationships with child care already. We're doing already doing a project with them called Choose Safe Places with Child Care. This would allow us to put those funds from the groundwater trust from DES into our budget so that then we can help child care providers do the mitigation they need, change faucets, do testing to make sure there's no lead in water.
Senator.
Thank you. I wanted to ask a question about that. We, in the couple of budgets ago, appropriated $1.6 million for schools and child care facilities to do exactly that work. Most of that, the huge majority of that money has not been spent. Why do we need to appropriate more money if the child care facilities already can apply for part of that $1.6 million?
So the Department of Environmental Services is asking us to help administer that and do the work to reach out to the child care programs. So they realized they've already done the work with the schools. They've worked with the Department of Ed. We have the relationships here to reach out and really work with the school, with the child care facilities So we will get the confirmation of whether this is new money or the same money just being moved over to
And
DHHS.
is it positions?
The only thing, it will support an existing position that's already in public health.
Okay, but that would be good to know if
Yes,
this is new money or
Yeah.
just.
it is. Yes, and I think it's a combination of, again, through their groundwater trust funds that is moving over to us. Thank you.
Senator D'Alessandro.
Thank you. Just as I understand it, it's a drawdown account.
Yes.
And as a result of that, the money's there. It exists there. The question is, will you, through some arrangement, have the money to draw down on the account for this purpose?
Yes. So, yes. And so what they're seeking public health to do is really we're going to probably enter into a contract with a vendor who's going to help us get the money out. But we already have the existing relationships throughout the department, as I'm pointing behind me to, Associate Commissioner Santinello. We're already working with the child care facilities so much anyway. And what's good with doing it in public health is we also have our lead poisoning prevention program who can help them with all the education on it as well.
But the key is the money
Yeah.
is there.
Yep.
Okay, thank you.
Yeah, it's just moving it. This process just moves it into
Right.
our budget.
Right. Okay.
Senator Bertzel.
Thank you, Mr. Chair. Thank you for taking my question. Is this the same bucket of money that the Water Commission uses to build water facilities through like Merrimack and?
So this particular set of funds I know is managed through the Groundwater Trust Fund. So I don't know the specifics on DES. I can get that answer for you.
Yeah, I'd like to know that info. Thanks.
Back to you.
All right. And then the last thing that we're asking on here is we are anticipating some increased federal funds for investigating and preventing maternal mortality and infant mortality, and we're asking for your consideration to add those federal funds into our budget now. I think most of you know that maternal mortality is one of the key indicators that we are looking at as sort of the health of our entire population as well as our healthcare systems. And then slide 21 is our final slide. We have some additional federal funding changes we'd like you to consider. Again, we have another partnership with the Department of Environmental Services. They have some resources for us to purchase some new equipment for our water lab. We have a relationship with them where we do the water testing for them. So they would like to get through an MOU, send us over some additional funds for some new equipment in our lab. That's really the main thing on this list, as well as some other federal funds. So thank you.
Senator Bertzel.
Thank you. Sorry. So when you say that you're anticipating federal funds becoming, how does that represent in the budget? Does the general fund, do we designate the money from the general fund and then you pay it back?
No, so in this case, we've received notice from our federal partners that we will likely receive awards in the amounts that we have budgeted. If we don't receive those amounts, then we would not be able to spend that money as it'd be budgeted as federal funds here within the operating budget.
Yep.
So you need the authorization from us to be allowed to draw down on those funds?
That is correct. So there's really potentially two options. One is we could budget the anticipated federal awards here, or we could wait and we could come back through fiscal at a later date.
Senator Bradley.
So that was my question. There's no need for us to budget because you can come to fiscal with the federal dollars, correct?
Yes, we could come forward. The reason that we're asking here is just because we have a very high likelihood of receiving them. It's not a situation where it's a competitive grant award and we're going up against 50 other states. This is a situation where we have a fairly high degree of confidence.
We would have likely had we known that when we developed our budget, we would have included them in our budget, but the notices have come forward in the past couple months.
So going back to slide 19, Choose Love program.
Yes.
Is this a new expenditure or is this a transfer from DOE to DHHS.
We believe it's a transfer from the governor's office to DPHS.
So no new funds?
No new funds.
Okay, thank you.
Senator Del Sandro.
Thank you, Mr. Chairman. Just a question about the STDs. In the past, you have sent money back to communities. Is that part of this appropriation?
So we have very limited federal funds to support our STD prevention work. We get about 300,000 in our STD grant from the CDC. We don't really get a ton of general funds to do any additional work. So we support clinics in Manchester Health Department and Nashua Health Department, but nowhere else. Again, if you remember to before, 2008-ish, we actually had general fund resources where we could give funding to federally qualified health centers and other folks that are doing sexual health clinics. We're unable to do that. So with the limited amount of money that we have right now, it's just Manchester and Nashua.
Right. So then anyone else who's doing the testing depends upon local revenues?
Yep.
Right.
Yeah.
Okay, thank you. Thank you.
Do you have a question, Senator Rosenwald?
Yes, but I think it's more for the LBA. The Choose Love money that is being transferred from the governor's office, was it actually taken out of the governor's office? Do you know?
I'm not sure because I think that one, correct me if I'm wrong, that was approved through fiscal originally, or am I thinking of something else?
I don't know the answer to that. This came through in an HB2 provision with the specific dollar amount moving the program to HHS.
Okay, so I'm not sure if it was ever budgeted in the governor's office other than as a result of an approved fiscal item.
Thank you.
Additional questions? I think we're good.
Okay.
All right. On that clock over there, we're going to come back a quarter of, and I will start promptly.
Roughly. So we got 5 minutes, 5 minutes?
Actually, according to that clock, you got 7 minutes.
7 minutes. That's an additional 2.
Great.
We'll call the committee back to order.
Good afternoon. My name is Karen Hebert. I'm the Director for the Division of Economic Stability at DHHS.
And Nathan White, Chief Financial Officer.
So the Division of Economic Stability, the mission of that division is essentially to enhance the health and economic and social well-being of individuals and families in the community. This division directly serves individuals and families, some temporarily, and some with long-term services based on their circumstances and eligibility for different assistance programs. We directly and indirectly support the business community in order to positively impact the state's economy. There are cost avoidance components to each of the bureaus within this division that prevent the need for public assistance. These programs contribute to the reduction in poverty, stabilizing individuals and families, transitioning them sometimes off of public assistance or preventing it, and of course, helping those with assistance who need it. Each program does this in a unique and different way. It's there when you need it, there when you can't survive without it. These programs that support and educate parents, building protective factors such as concrete supports and resiliency, ultimately preventing the child welfare interventions. You'll see on the organizational chart on slide 3, each of the bureaus within this division. From a budget perspective, the lead programs for this division are the Bureau of Child Development and Head Start Collaboration, the Bureau of Child Support Services, and the Bureau of Family Assistance. And in the budget, a number of the other programs and bureaus fall under each of those lead bureaus. These programs attribute to stronger families. For example, collecting $76 million in child support payments, 92% of which was dispersed to families in federal fiscal year 21. We help individuals attain credentials for high demand, higher wage employment, and a stronger workforce skill development. We have a child care and early childhood data system for families and providers and professional development systems and opportunities. We offer home visiting, parent education, and barrier resolution services that prevent involvement, again, with the child welfare system. We maintain a strong infrastructure, utilizing newer case management practices, high involvement management principles for positive culture environment. We have call center services for family assistance, which is desperately needed right now during the Medicaid unwind process. We have distributed over $113 million of federal funding to New Hampshire child care providers since March of 2020 for the recovery and stabilization of that industry, with several other long-term sustainable solutions through different initiatives that are in development at this time. We have revised New Hampshire's quality recognition and improvement system for child care providers, known as the Granite Steps for Quality. We apply a whole person and whole family service delivery model. We have individualized employment and education services and opportunities to reduce the dependency on public assistance and to reduce poverty. We're implementing strategies at this time to mitigate the cliff effect, and we're also working on plans to increase the utilization of SNAP benefits. New Hampshire Easy, which is our self-service portal to the eligibility programs. We're making enhancements for that particular portal for greater client access and to reduce the manual workload among staff. We're also looking at ways we can try to align and modify eligibility across programs, including SNAP, Child Care, and TANF. Going through each of the lead bureaus, I'll start with the Bureau of Child Development and Head Start Collaboration. This is quite a robust program that does maintain and administer the New Hampshire Child Care Scholarship Program, otherwise known as Child Care Assistance. This bureau works on strengthening the child care system that ultimately supports business and economic development in the state. We provide a lot of different methods for professional development and opportunities for child care providers. We work to help parents make informed choices about the development of their children and choices about where they would acquire child care for their children. There is a strong focus on quality of child care in order to improve a child's readiness for success in school. The Bureau of Child Support Services, this is services for families. This is not an eligibility program. It's services whose parents do not reside in the same household, or it may be a parent and caretaker of the child. One of the key functions of this particular program is to establish paternity or parentage for children, legal parentage. This is really important for a number of reasons. One, because of the pursuit of child support for these families, but also for the sake of the child, in order to have access to information about their parents or access to any inheritance or benefits that that child may be entitled to that wouldn't otherwise if it weren't for the legality of that parentage. We engage and assist parents who are willing and able or unable to support their children. When it's necessary, we will enforce the responsibility with parents who are unwilling. And as I said earlier, we process about $76 million a year in support payments that are distributed within 48 hours, usually less, lessening the need for government assistance benefits. The Bureau of Family Assistance does many, many things. Administratively, through the Director's Office, we administer the Supplemental Nutrition Assistance Program, known as SNAP, as well as the Temporary Assistance for Needy Families, known as TANF, and multiple state supplemental programs. Through policy and business oversight, we administer these programs, ensuring access to and the delivery of those services for medical and financial assistance. We also work very closely with the Family Resource Centers statewide that includes the Kinship Navigation Program. The Bureau of Employment Supports is identified under the Bureau of Family Assistance in the budget, but it is its own unique bureau. It provides services to the TANF recipients who are required to participate in the New Hampshire Employment Program. So there are a number of ways that we do this in order to find sustainable employment for individuals. It is not an emergency program such as other state agencies like Employment Security. It is meant to find long-term sustainable employment for people. That program also maintains very strong relationships with employers within the community so that we can identify what the labor market needs are through training and education and try to serve our employers as well. The Bureau of Family Assistance also, on slide 8, oversees the field activities, which is all the eligibility determinations, application processing in our field offices. This includes eligibility for Medicaid, TANF, SNAP, Child Care Scholarship, and all the other state supplemental programs. This bureau also maintains the integrated eligibility and enrollment system known as New Heights, as well as the self-serving portal known as New Hampshire Easy. Under this budget, it also maintains the unit that determines medical eligibility for disability benefits. I'll stop there if you have questions.
Senator D'Alessandro.
Thank you, Mr. Chairman. The program that chases delinquent payments by so forth, ex-husbands, et cetera.
For child support?
For child support.
Yes.
I've said this before, that's on the second floor of the main building at the old New Hampshire Hospital.
There is the interstate unit, yes, that's in the second floor. We took a tour of that a couple of years ago, yes.
Is there any thoughts about refreshing that place so that it's a decent place to work?
That's a great question, one that I would defer to the facilities folks.
I think that the commissioner either wants to come up or you can sit right at the end of the aisle there and you'll have your own microphone.
Yes, as part of the roadmap, I mentioned keeping people as important in their working environment is just as important. Our challenge is that we don't own the space, nor are we responsible for it. However, if you could help us persuade the agency that is in charge of that to work with us to do that, we will. That is important to us as well.
I certainly will do my very best. I must say this, Mr. Chairman, I want to compliment the people who work in that area. I mean, truly. I've been there many times over the last few years. I'd say many years, you said 76 million they collect. I mean, that's a huge amount of money that the state doesn't have to come up with, and they do it. The conditions aren't the best. That's all, and I'll do whatever I can to make them better.
Thank you for your support.
Yep. They
Additional
certainly do
questions?
appreciate your support.
Senator Bertzel.
Thank you, Mr. Chair. On your Bureau of Child Development and Head Start collaboration, does that particular program include, does that cover from birth to school as well as prepping the children for school, or?
So for the Child Care Scholarship Program, it is birth through 13.
I'm sorry?
Birth through 13.
Okay.
Mm-hmm.
Great, thank you.
You're welcome.
Back to you.
Great. So on slide 9, it really is a high-level overview of the budget for this particular division, broken down by each of those bureaus. And I can go through that if you have questions. The total amount for the Child Development Program both is, that's from the governor's budget, is the same as the House budget. And each of them, if you have questions, then I'm happy to answer them.
I don't see any right now. Oh, Senator Bertzel.
So it says general fund, so I'm looking at fiscal year 2024. So the general funds will be 13.6. At total funds, so out of that 41,000, that's going to be federal funds and others?
Correct. It's primarily the Child Care Development Fund, also known as CCDF, which is a federally funded program that provides the funding for the scholarship program as well as quality dollars and professional development.
Absolutely.
Is that like, it looks like it's more than half, 50%. Is it like 2/3 to our 1/3, something like that?
That sounds about right, yeah.
Thank you.
Thanks.
Back to you.
Excellent. So there were a few house changes. I'm looking at slide 10. One in particular for the 6127 accounting unit that decreases the budget due to a couple of things. Primarily, there was a program that we stopped conducting because it was determined to be ineffective, no value to it. So that reduced the budget for that item. An accounting unit 7214, this is specifically for the Bureau of Family Assistance, field activities, more specifically for an audit on the eligibility and enrollment system. And that's an audit that we do regularly, so we're including it into the budget as opposed to requesting it as a prioritized need every biennium.
And that during that, when the governor's budget came forward to the House, this was actually included as an HB2 provision. So the House converted it from HB2 into HB1 into the operating class line.
Senator Birdsall.
So, it says addition of 838. So they increased it in what, HB1?
One.
To put into your budget. Okay. I'm sorry, I thought they took it out. Thank you.
Senator Rosenwald.
Thank you. I have a few questions about TANF.
Sure.
In House Bill 2, those sections 386 and 388, they look like they mirror Senate Bill 237, but the source of funds is different. I think the Senate bill used general funds and the House decided to use TANF funds. Are we using now, I mean, the way the House did it, as much TANF funds for childcare as we're allowed to under federal law?
The use of TANF funds, if we use TANF funds specifically for childcare, it takes on the characteristics of CCDF. So it would need to meet the same requirements as CCDF funding. In Senate Bill 237, these two items were included among several others with respect to the eligibility of the scholarship program. So these two items, essentially, the intent would be to make use of CCDF funding first. Then if we needed it, this allows us and gives us the authorization to use TANF funding if we needed to.
Can I follow?
Senator.
So we have like $67 million of TANF funds in reserve. So we could do this.
Yes.
Okay. My other question about TANF is in section 227 of House Bill 2, which is general fund appropriations of $5 million over the biennium to meet the maintenance of effort. If our TANF caseloads are down like 2,000 cases versus a couple of years ago, why is the $32 million that we always spend to get the federal drawdown, why is that not enough and we have to appropriate $5 million more?
Sure. So RSA 9.4 requires that agencies during the early phases of the budget that we submit our budgets, and we have an efficiency budget and we have a prioritized needs budget. And the governor's office provides us with additional guidance on how to do so. When we put forward our efficiency budget, the $3 million that was included in the governor's budget in HB2 each year for TANF dollars, that did not fit within that efficiency budget as defined, so it ended up being an HB2 provision. For everyone's awareness, the state receives approximately $38 million of TANF dollars each year. The maintenance of effort, that's the amount that the state has to spend of general funds, is approximately $32 million. If we don't spend the $32 million of TANF funds, then the subsequent year we will likely receive an equivalent amount to what we did not spend plus potential penalties. So if we spend $30 million the next year, instead of receiving a full $38 million, we may only be receiving $34 million from the feds. We can provide a document that we provided to the House that shows how we budgeted all of our TANF funds. And the challenge, though, is that comes out to about $32 million, excluding the HB2 provision that you're referencing, Senator Rosenwald. But the way that we've budgeted assumes that all of our positions that we can allocate TANF funds to are going to be filled, and we know that's not necessarily going to be the case. We also have approximately $3 million of other revenue budgeted there as well that we may not necessarily receive. So during the House phase, again, the governor introduced the HB2 provision as $3 million of general funds each year to be used towards TANF Most likely that would be used for cash assistance to make sure that we hit the MOU requirement. In working with the House was trying to come up with additional funds. So there was a reduction of $500,000 each year to that HB2 provision.
Follow up?
Have we ever had to appropriate in House Bill 2 general funds to meet that MOE? Or have we always just managed to spend that in House Bill 1? I don't remember ever seeing something like this.
Not in recent memory. It would certainly be the preference of the department to include that within the operating budget, so it would be consistent with future budgets going forward. But whether it's an HB2 or HB1, we can operationalize it one way or another.
Thank you.
Additional questions? Oh, Senator Bradley.
Going back to sections 385, 387, the child care services, and the comparison to 237, Senate Bill 237, which is on the table, I think that the House has picked up the major provisions in 237, except for the workforce retention part, which I believe was section 4 of 237. So I guess my question is, well, is that the case first? That we picked up the major provisions of 237? The House has. Maybe slightly differently in how they do it, but.
Yes, well, the more costly provisions, yes. So the state's median income at 85% for the adjustment of eligibility is 8.6 million projected. And then the 75th percentile of the weekly based payments, the payment rate would be $2.9 million that's projected. The other items in Senate Bill 237 include eliminating or reducing the parent cost share, as well as providing the enrollment-based payment instead of the current method of payment, which is absentee method of payment. So the some of the items that are in that, the state had already budgeted for, which includes the enrollment-based payment.
And that was the pilot program from last year, is that correct?
Correct.
So you've already budgeted for that?
That's correct.
Okay. So, thank you, Mr. Chair. Just based on the prior discussion about use of the TANF funds and maintenance of effort, it does make sense then to utilize TANF funds for this purpose. Is that correct?
Yes.
Yeah. Okay. All right. And the parent cost share, that has not been funded elsewhere.
That's correct.
Okay.
Additional questions? Back to you.
Very good. So the last slide, slide 11. This includes budget areas for consideration. Specifically, there is a part-time position that we are asking for funding for. This is a position that's specifically being created for the long-term care unit, basically to assist staff with processing redeterminations in the most timely manner possible during the Medicaid unwind period, specifically for this vulnerable population. It also includes that $838,000 for the audit to the eligibility enrollment system and a reclassification of our eligibility staff.
Senator Bertzel. Excuse me. Senator Rosenwald. I saw something over to my.
Thank you. I have a question about the unwind position. Doesn't the unwind have to be completed by the end of this calendar year? Why do we need to keep unwinding it for 2 more years? I'm looking at Henry. Lipman.
Oh, is Henry here?
Henry,
Oh, Henry is here.
Henry, if you want to respond, then you need to come up. You can sit at the end of the table.
It just seems like, I thought it was this time limited that states had
I could try.
through the year to get the redetermination backlog done. But it's gonna take like almost 3 years?
We give you your own mic and everything.
Thank you, Mr. Chairman. For the record, Henry Lippman, State's Medicaid Director. In terms of the unwind activities, in terms of Medicaid eligibility, we are aiming to complete that by the end of this calendar year. So I'm not sure in terms of the if there's other unwinds that we're doing, like in other categories. So I'd look to Karen to see if she could amplify to that.
Yeah, I think that there's the residual effects of Medicaid unwind. I mean, this is something we've never done before. So we're anticipating that there are going to be impacts for families, particularly of those who may lose their Medicaid coverage and then come back to us when they realize that they still need to apply for Medicaid. So I think that it's a process, and we're just trying to make a determination and projection as best as we can as to what the impacts are going to be for families. So the supports and resources that we need for this for a little bit longer than an anticipated year, I expect that the door isn't just going to close and it all be gone. So we're anticipating just what we may need to provide support to people.
If I could add to that, I think that it's true in terms of what the unwind is getting all our eligibility, initial eligibility determinations caught up by the end of the year. I think Karen's correct that there'll be, things will play through after that because people, even into the next calendar year, people have 90 days to, come back on without doing a new application. There could be appeals that run longer as well, and her team prepares the documentation for the appeals unit to handle, so it could extend out into 24 a bit.
Follow-up, Senator Rosenbaum?
But would it also extend into 25?
It's a bit of an unknown. I think
It's
that
not very much money, but still, I'm
Yeah.
surprised.
I think that the one thing I always consider is the fact that our environment has completely changed, and we want to make sure that we change with it. And so in consideration of what we've been expecting, expect the unexpected is really kind of the theme of where I'm going with this. So just to be in preparation, we don't know what's going to happen at the end of this year or even through the next fiscal year. And it could be. We just need to reevaluate it along the way regularly. You're welcome.
Senator Bradley?
So, I mean, this, I guess, is a follow-up on the question that I had of you a couple of weeks ago. I believe the appropriation for the unwind is about 16 million.
Correct.
You told me when I talked to you that the unwind is going relatively well. The people that are being disenrolled are the ones that are clear cut. So I think I had asked you at the time, is it possible that that 16 million, all of it will not be necessary? And do you have an update as to what that might be?
So I think that we've got 1 month and 2 weeks of experience of doing the unwind, and as mentioned, that I do think there's some possibility if things go well that we may not need that whole thing, but I think the first part of the unwind is really we did a risk-based approach, which the people that we knew were ineligible or hadn't used healthcare services in a year, those were the ones we did first, and that's what we've got experience on. The more difficult cases, people that had consumed healthcare have been more vulnerable in terms of how that's going to play out. It's a little less predictable. I think that I had mentioned that the original assumption in which the current budget's based on was assuming that the unwind would have begun in October, and it started in April 1st effectively. So that's, I think, when we were preparing the budget, not having clear sense of how this was going to play out. I mean, so far, it's moving, I think, the way we'd hoped to, that people are transitioning. It's not a perfect process, but it's in terms of what we expected, it's going according to plan. And if we are able to move through quicker, there's a chance we won't necessarily need that all.
And federal reimbursement,
Yes, thank you for mentioning that. That's the other thing that's changing is as part of the Consolidated Appropriation Act, the 6.2% is dropping to 5% effective April 1, then 2.5% in July, then 1.5% for the last quarter of this calendar year. So that's another factor in terms of how much money we might need if we have to carry the population longer, because the 6.2% has just been about enough to cover the extra enrollment all the way through. The issue that we don't know is so far we're doing as well or better than expected in terms of how things are playing out, but we were concerned if there were lots and lots of appeals that we still have to provide coverage, that with the FMAP, federal matching percentage, going down, we had a risk of not having sufficient funding for that. New Hampshire, just as from a benchmark standpoint, for every extra dollar of cost that we had for carrying the population, got about $1.01 worth of extra match. Some states got considerably more. That's why we began our planning process in July of 2020, because we knew that when it came time that we weren't like some states that have a much higher FMAP percentage, having a lot more time to get it done and not running into a budget problem.
I think it's safe to say we should have this conversation mid to late May again, and in terms of that appropriation.
I think that's fair.
Have there been any appeals so far?
There have been appeals, but in terms of what we expected to see in appeals thus far, has not been as high as we thought it would be. But again, I think this group, the first group that has gone through, are the ones that were less likely to appeal because they were either over income or not used services. As we move further into the unwind, there's, I think, a higher probability of appeal. But we're doing our best to do appeal pre-resolution and doing things to do outreach, working with our partners on that. We're trying to do the best job we can to minimize that activity.
Okay. Thank you.
Any more?
Nope.
Back to you.
I have nothing further.
All right. Thank you very much.
Thank you.
Whenever you're ready.
Good afternoon again. Henry Lippman for the record, State's Medicaid Director. I think you have a copy of the slide deck. I'll try to run through it to leave as much time for questions. Basically, the Division of Medicaid Services really has two core functions. The first is running the health insurance program, which you're familiar with, that through the Medicaid care management organizations, and a small amount of fee-for-service. The second role that we play is sort of we're the intermediary between CMS and the department, and work with the other programs, whether it be behavioral health, DCYF, long-term services and support, on waiver and financing type issues. So we kind of play two roles in the department. Slide, I guess one more thing before I go to slide 3 is just in terms of our program, I think it's important to note a couple things. One, that compared to other states, New Hampshire, as a percentage of our population, is the fourth lowest Medicaid population in the country, and that's been consistently so, even with the large increase in enrollment that we've seen. And that's statistics cited from the Kaiser Family Foundation, who does a report for each state. We also have a high level of engagement with respect to employment on the part of our beneficiaries. And I think when you look at the Medicaid program combined with what the Department of Insurance is doing with the 1332 waiver, and our New Hampshire is also has the highest level of employer-sponsored insurance. I think we have the right buckets together in terms of managing risk from an insurance standpoint that has led to us having, the highest employment participation in terms of employers offering insurance, having the lowest benchmark premium for the exchange, and in terms of Medicaid program, both its size and its cost, I think, are competitive. We do it with a fairly small team, which is slide 3. And if there aren't any questions on that organizational structure, I think the other piece we picked up this year is an adult dental program, thanks to the good work of the legislature. And I'm pleased to say that I think the last statistic I heard, we have 109 dentists enrolled, including oral surgeons, and we have, I think, 66 locations throughout the state, and even some of our border states have, Massachusetts and Maine have, some oral surgeons have participated there. So we're off to a reasonable start there, and still have more network development to do, but Delta Dental is working very, very hard to bring dentists on board. On slide 4, I've sort of covered the content here. We not only work with other divisions within DHHS, but we also interact with other state departments, work with the insurance department in terms of very closely on this unwind issue, in terms of making sure people are aware of the opportunity, if they're not eligible for Medicaid, that there may be opportunity for exchange coverage. They also work with us on the premium tax that's collected, and working back and forth, and the estimates that support the financing of the Granted Advantage program. The Department of Revenue Administration in terms of the collection of the Medicaid enhancement tax and the funding of uncompensated care. The Department of Corrections, we work with trying to make sure that there's a good transition from people coming out of prison who are eligible for Medicaid, that they're, rather than terminating people from Medicaid that go into prison, we do a suspension. We also have a request for our renewal of the severely mentally ill and substance use disorder waiver. We have a request to include bringing on coverage of transition services so that people get connected better. For example, if they're getting SUD treatment in the prison or mental health treatment, that the federal government's, I think, willing, based on a recent waiver, to provide some funding to states to provide transition services so that people get connected really completely when they leave incarceration, so that they are successful in integrating back into the community. And then lastly, the Department of Education with our Medicaid Schools program. So it's one of the parts I enjoy about working in this position, is you get to work with a lot of parts of state government, and even the Department of Employment Security we worked through during the pandemic. So I think we try to work to support all of state government in minimizing the social service costs that the state incurs. I think on slide 5, people are familiar with what the insurance program is, who sit on this committee. We basically cover anybody within the Medicaid program who's eligible for coverage, and we work with other program areas and within the division on state plan amendments and waivers. Slide 6 is a slide about the Granted Advantage program. I know through the consideration of Senate Bill 263, you have a lot more information that's contained on this slide, but I'm happy to answer any questions on that. Slide 7 is a snapshot of what's been happening with enrollment and the unwind in the early stages. The very top of that slide where it says the period 316 to 327 of 23, that was the top line there is the height of our enrollment. And what we've always measured against is when the start of the continuous coverage effectively went into place, which was in mid-March of 20. And you can see that Granite Advantage hit a high point of 96,515 and standard program at 154,842. The next line down is as of last Monday, the Granite Advantage program now stands at 82,722, standard at 144,500, and combined 227, 222 versus the 251 basically at the end of March. We do expect the way we approached our unwind that we expect higher levels of people transitioning off of Medicaid early on because of how we're structuring it, and as we go through, we'd expect that that number would come down some. I think the other thing that we've learned, I think in the first 6 weeks of the program, is that we've had a hyper focus on the 103,000 people that had the protected continuous enrollment coverage, and where we expected 89% of the first month of individuals to close for Medicaid, only 71% did, but there's also the group of people who are coming up to their first renewal in terms of their completing their paperwork and stuff. And so we need to, I think, adjust our messaging to both capture not only the people that have been protected over the last 3 years, but the more current individuals. But the total change in enrollment was really right on the number that we predicted for the month. And let me stop there, sort of the non-numeric kind of content. If there are any questions?
Questions? I think they're happy with you so far.
That's good. I think starting on slide 8 is, I guess, it summarizes the general funds and total funds in the program at the top of the page. There, I guess we're getting into talking about the House changes. I don't know if you want to pick up a little bit here.
At the top of page 8, you'll see the table for the activity, and this includes all the Medicaid accounts. You will see a change between the governor and the House budget. What happened here in the current biennium, the MMIS system, and we spoke about this when the commissioner and I had come to speak with the committee a short while ago. MMIS is currently budgeted in HB2, and so roughly $10 million each year, plus the federal match, which is another $30 million, give or take. What the House did, and when it was introduced by the governor, MMIS, the maintenance costs were also included in HB2. And the House did a couple of things here. So what they did is they modified the HB2 section, and they said that out of the department's lapse, the dollars for this program would come forward and they'd be treated as restricted revenue. And they added that to HB1. The challenge that we have right now, and we can talk about this a little later, but the challenge right now that we have from a technical perspective is it's showing up as agency income. And if you take general funds as a lapse forward, it actually kind of breaks the logic of the accounting system. And we've had conversations with DAS to figure out how we could do this. Currently, as HB1 is introduced, the agency income we won't actually be able to earn because you can't earn general funds through the system. So that is the change there that you see within HB1, but otherwise there were no changes. And so within the House changes, that Section 211 is what I was referring to. There's also a new appropriation to fund the inclusion of certain children and pregnant women in Medicaid in the CHIP program for the next biennium. The Medicaid rate appropriations, originally the governor's office had put forward $17 million in an HB2 provision each year, total of $34 million. The House increased that figure through the use of a targeted methodology to $134 million. There was also an appropriation of $200,000 for postpartum care within the Medicaid program. There's also a number of provisions between sections 397 through 406 relative to Granted Advantage. The House's position on that was a 2-year renewal, and I'll let Henry speak to all of the challenges associated with renewing the program every 2 years. I'll pause there and I'll let Henry speak to that in just a second. They also, the Governor's Commission funding was also addressed. So for approximately the past 4.5 years, the department every 6 months has received a $5 million donation from the Hospital Association to fund the Governor's Commission, and Katya Fox with the Division for Behavioral Health will be speaking to this tomorrow. This change here is, this would fund that program, the Governor's Commission, through the Alcohol Fund. And then finally, one last key provision that was included within the House's budget is the Granted Advantage Healthcare Program currently sits in a trust fund. You're actually not seeing it within HB1 in the operating budget. This would require the department next biennium to include the Granted Advantage program in the budget. And then the final last change here on page 8, the House changed the, excuse me, within accounting unit 8009, again, this is the MMIS issue. This is just the other HB2 provision here. So, and maybe I'll pause there for questions since there's quite a bit there to unpack.
Senator Rosenwald.
Yeah. So the House put the Granted Advantage program in the budget, or they're saying in the budget after the next one? It's supposed to be in there.
The latter statement, Senator.
Okay, thank you.
Back to you.
So on Granted Advantage, if I could speak to that, then I'd like to hit a couple of the other ones if I could. So the 2-year reauthorization, I think, is problematic from a procurement of the managed care program. We're due to kick off the re-procurement this September. The current contract ends August of 24. What ends up happening is, if you're interested in being a bidder to get into the program, you only have 16 months of effective authorization of that program. And it's been to the state's advantage to have 3 managed care organizations for choice, but also when we were required under our structure to have 2 all the time. So the leverage that in a negotiating process when you're dealing with a partner that, basically one leaves when you only have 2, you've got a big problem. And so having 3 has been good for the consumer. I think it's been good for the state to in a number of different ways. What I've written to the House Health and Human Services and Elderly Affairs Committee over the weekend, just explaining that really a 5-year or better, a 6-year, which would cover the whole contract term, would be the way to go, so that if we do want competition for the next procurement, that it's hard for a company to come in, make a major investment, and being unsure whether they're taking some risk as whether reauthorization occurs, and you need about 50,000 individuals to come in and run the program as a minimum, is what we heard in the last procurement process. So, if 50 or 60,000 of the entire population potentially may not be around in 2 years, you think twice about whether you want to heavily invest in a program. They expect to recoup over 5 years. I think if you think of anybody that's been in business with an audit firm, usually there's a startup cost that's spread out over the length of the term of the contract. I think similarly, there's a lot of infrastructure work that these plans have to do to prepare. On the postpartum coverage, I think that in Senate Bill 175, the appropriation is 300 and 300 because I don't think the House, I think, may have looked at the prior year fiscal note and also the timing and when we would have implemented if we did in the last legislative session. And the second factor was the increase of the 25% in rates that were passed last session for hospitals to deliver babies and the rate increase to birthing centers. So we felt 300,000 was the right number, and I think that was just probably an oversight with respect to that and all the things that the House was working through in terms of coming up with rate changes. On HB 249410, that section there, that's for that was introduced last year and didn't pass this year. It did pass in the House, and this is for lawfully residing adults and children, for pregnant women effectively and their children, is that these are people who are going to get coverage when they meet the 5-year requirement. And I think the reasoning here is that if someone's going to live in the state and they're going to be covered ultimately potentially by Medicaid, particularly if they're a pregnant woman or a child, that you don't want to compromise the early part of life because you end up picking up a cost that's much higher than dealing with it on an upfront basis. So I think that covers what's on that page. Any questions?
Senator Rosenwald.
Thank you. I do have some questions about the rate increases that are in House Bill 2. In section 10, well, at the bottom of page 74, there's essentially $9 million for rebasing rates for the community health centers to ensure that they're sufficient to cover the cost of service provision. But the next section after that appropriates like another $3.5 million to bring those rates up to Medicare reimbursement. I guess my question is about section Roman 11. If 10 brings the rates up enough to cover the cost of provision, then what is increasing it to the level of Medicare? What is the purpose for that?
So it's a very good question. It's a little bit complicated. We currently have a state plan authority around how we reimburse federally qualified health centers that dates back to 2011, where the transition happened federally in terms of how federally qualified health centers were paid. What we'll need to look at and analyze is at the time it was to be based on the cost that the federally qualified health centers were incurring, sort of a cost-based reimbursement, right? And then it was, so there was this base year 2011, then it was updated by an inflation factor. What we need to do is relook at cost reports and see kind of where they are and how much of this we can put into use and be consistent with what the Medicare regulations are. We haven't done that analysis yet. There's also, so I think we have to sort of do some work before we can, give you an answer whether all that money can be used for that purpose or not.
Can I ask another question?
Yes, ma'am.
On the next section, Roman 12, is like $24 million for increasing developmental services rates. And I'm just wondering, of this current biennium appropriation, how much will remain unspent because of workforce challenges, and it doesn't lapse, it's going to carry over, could be used for rates? How much are we talking about?
Sure. So under RSA 171A, the DD account is non-lapsing and continually appropriated. So any funds that go unspent within that account would technically be carried forward per that statute. The Division of Long-Term Supports and Services will be presenting tomorrow. And earlier on, so back in January, when we were looking at the trends, we were looking at somewhere in the vicinity, I think close to $55 million total funds. But you have to remember there's also the enhanced FMAP within that We've seen those trends continuing to go up, and I'll bring that exact figure tomorrow for the presentation. Because but again, I think with those funds, it's important to remember that per the statute, those were prohibited from lapsing those. So.
One more question.
Yes, ma'am.
Do we have in House Bill 2 any sort of similar language for the CFI program that the appropriations won't lapse? Or was that in session law and any appropriated funds that are unspent will lapse? If you could let me know tomorrow or whenever.
Yes, absolutely.
That would be great.
There is, I believe it's approximately $21 million over the biennium. There is an HB2 provision to continue to fund maintenance costs. I believe the provision you're referring to is an HB1 footnote in the current biennium, and I'll double check and just get that ready for tomorrow's presentation.
To see if we need to re-up it. Thank you.
Senator Bradley.
Thank you very much. So, going right to the CFI appropriation, I think it's section 210. It's about a $16 million appropriation. How does that play into, sections, well, all the Medicaid rate increases that are starting around section 231?
Go ahead.
So the section 210 there. So this is similar to the issue that we had around TANF, where it wasn't incorporated into the efficiency budget early on. It ended up becoming an HB2 provision. The dollars here would continue to fund maintenance services. So these dollars are not for rate increases. These dollars are to continue funding projected maintenance services.
Okay, so then am I to assume that this is a continuation of funding levels that have occurred in the past? Okay, all right. So turning to all the Medicaid rate increases, I think that I would like you to have some of the discussion that Henry, you and I have had, that about the whole issue of parity among services, and that the department, instead of it being prescribed here, section by section by section, that there ought to be, at least in your view and mine too, greater flexibility for the department with regard to these funding levels, so that you ensure compliance with the CMS requirements of parity. So if you could elaborate on that.
So I guess my first thing is that we have in place today is a situation where there's sort of adverse selection against waivers because rates are not equal for this same service. So where people want to choose to work, and it's a artifact of just what's happened in terms of targeted rate increases that were intended to help one area that then cause an issue in another area. So I think it's really important that, given the investment that the legislature appears to be willing to make in Medicaid rates, that we, put that issue to rest, and that I think that within what's appropriated here, we would be able to do that. So I don't know if that speaks to all that you were looking for me to.
Yeah, I mean, obviously, you you have to be able to do it to comply with federal guidelines, right?
Yes, I think practically it's been a real problem for the administration of the programs.
Right. So I guess what I would be asking is that you work with Kevin on that language to make sure that we can incorporate that at whatever level of funding the committee agrees on. So I'm assuming section 438, which is also the system of care, that's also a maintenance of effort issue.
I
The
think that,
$5 million, I think it was a $5 million appropriation.
sorry, residential rates, yes. It's the, if you want to comment on that.
Sure. So Katya Fox is going to be speaking to this issue tomorrow. The House did appropriate additional general funds for residential contracts or residential treatment providers, but it was about half of what the department needs. There was a floor amendment when HB2 and HB1 were in front of the full House. That added the additional $5 million. Tomorrow, we still will be requesting, off the top of my head, I think it's something in the vicinity of approximately $11.5 million in general funds to ensure that those residential facility contracts that we have are adequately funded. And Katya will speak to those tomorrow.
All right, my last question, I think for now, is we've put in the Senate Bill 36 onto the table. That's a system of care under the CFI, and I think that there's broad support for it here to include it in the budget, so you're going to have to, again, work with Kevin to make that happen.
Additional questions? Seeing none?
Me too, thank you.
If you turn to page 9, there are two HB1 areas for consideration. Skipping ahead to the second, this is the MMIS technical issue that we were discussing. One option, and this is one way to do it, would be to essentially what we've proposed here. If there's a corresponding HB2 amendment to just fund the maintenance costs out of HB2, it would zero out these lines. Those other funds there, those are the dollars that I referenced that we wouldn't actually be able to earn. And then the first item there, this is the state phase down. This came up last week at fiscal committee where we had to transfer funds to general funds and to cover these costs that are currently unbudgeted. These are payments that we make directly to CMS to cover dual eligible individuals for Medicare Part D premium payments. On page 10, going back to item section 231, this speaks to the Medicaid rate increases that Senator Bradley was referring to. This is consistent with what we were requesting, just relative to having the ability to address those rate parity questions, other contracted rates, and other similar type scenarios. Section 211 there, the first item at the top is the MMIS, just discussed this. And then, Henry, do you want to speak to section 408?
Sure, this is what we were talking about earlier, that we had for the postpartum coverage, 300 and 300, since the House had appropriated 200 for 1 year. The 400 would allow us over the biennium to have 300 and 300.
And then the HB2 sections that are included there, these were included in the governor's budget and subsequently approved by the House. We have the $16.3 million general fund appropriation for continuous enrollment, and we will be tracking those numbers carefully to come back to the Senate here in the coming weeks to identify whether that amount is still necessary and needed. There is a provision, section 196, this would allow us to carry the Medicaid dollars forward, any lapse out of this area to 2024-25. This language here, this mirrors language in the current biennium, and the reason that we're asking for this is because of the unknowns associated with the Medicaid unwind. We still don't know, once we move into the coming months, whether we're going to have higher appeals, and anytime an individual appeals a determination, they remain in the program, and we would still have a cost there, and that's intended to provide the department with a buffer. Medicaid to Schools program, this provision here, section 195, this would allow the department to come forward to the fiscal committee to request additional funds in the event Medicaid to Schools program exceeds the appropriated amount. We have this language in the current HB2. We have not come forward to request these funds. Go ahead.
Yeah, this actually came from the Senate last session, and as you know, COVID affected schools' ability to do Medicaid to schools type therapies and such, and this would be 100% federal funding if the need be, and it's basically we're saying if the schools can fit the need and it's above what you had appropriated, that we could come back and draw additional federal funds again at 100%.
Senator Bertzel.
Thank you, Mr. Chair. Thank you for taking my question. So on 408 on page 10, so I notice here that the House has appropriated $200,000 for the postpartum. Are you saying you want an additional $400 each year for a total of $600,000?
No, 600,000 over the biennium. 300,000, like is in Senate Bill 175. Basically, our fiscal note for that was 300,000 for each of the 2 years, and I think I'm not sure why, but during the machinations of pulling things together at the last minute, I think things got off kilter with respect to the House appropriation for that.
Okay, so you're asking for another $100,000 each year.
Well, they only appropriated 1 year worth and 200,000, so it didn't take into account the.
Okay, got it. Thank you.
Additional questions?
Yeah, sure. HB2, section 197 is we feel that in consultation with Dr. Ballard and looking forward to our next procurement, that in the literature, our medical director identifies that the most solid savings that occur in a program is by preventative services, and so what we're asking for here is the authority to expand our preventative services. We're not asking for additional appropriation because we feel ultimately that cost will be it'll pay for itself, if you will, over time, but that to have the flexibility to do a little bit more in the preventative service area will be good for the long run cost trajectory of the program.
And then section 208, we have 2 positions that are being converted currently from classified to unclassified. I believe these positions have received enhancements for almost a decade. In speaking with the Division of Personnel, they had actually recommended that we convert these positions. I believe they're currently receiving a 30% enhancement, and there are 2 of them. And then sections 193 and 194, these provisions suspend graduate medical education payments and catastrophic aid payments to hospitals for the biennium, and this language is consistent with some of the language you've seen in the past.
I'd just like to amplify the pharmacy position importance. These are 2 long-term individuals managing about 19% of the Medicaid spend in terms of pharmacy costs, and I just want to make sure they don't get hurt in the transition, which is what this provision is for.
Senator Rosenwald.
Thank you. These last 2 things, 193 and 194, they're only through the biennium that runs out at the end of this June. There's no language.
That is a
in
typo.
House Bill
It should be 25.
Oh, so it's.
Yep.
Okay.
That's my fault.
Okay. Thank you.
Good catch.
Additional questions? I think we're at the end.
Very good.
Thank you very much. Okay, I'd like a motion to go into executive session just for a short amount of time so that we can discuss stuff. Motion made by Senator Pearl, second by Senator Birdsell. All those in favor say aye. Aye. All those opposed, We are in executive session. Again, you got the sheets here, and I guess there's another version out there that has the dates of the hearings and all of that. The ones that say ready to exec, that was only my opinion. If you guys don't think that those are ready, then you should come back and tell me so we can get them updated. I do want to start tracking this stuff so that we can, put things that, huh? You may not have it with you, right? This,
It's in the brown folder.
yeah, I'm not sure exactly where it is in stuff you have, but I want to start checking things off the list, all right? So we've got another session tomorrow, so we'll take care of getting that. Is there anything that anybody wants to discuss here in the executive session? Senator.
The items that Senator Bradley has requested, we'll see those tomorrow, that he requested for.
I doubt it. I mean, there's a lot of work to incorporate the changes that the House put into, I think it's starting at section 231, and the need for compliance with CMS regs. So I think Henry's got to work with Kevin to, come up with language on that. Same thing with Senate Bill 36. There's been a lot of discussion since the Senate tabled that bill, whenever it was, probably in February, on, how to do it. And actually, I think, credit to the department and to the advocates for working together to come up with something that I think I would hope, be able to support universally. But again, I think that's got to be drafted into an amendment.
Anything additional? Got a motion to come out of the executive session? We have a motion and a second by Senator D'Alessandro, Senator Birdsell seconded. All those in favor say aye. Aye. Our business today being complete, we are adjourned.